Everyone knows the heart is important, but how many people actually take care of it? We tend to think heart attacks come out of nowhere, a sudden event, no warning. But in TCM, we have a saying, smooth flow means no pain, blockage means pain. Heart disease doesn't happen overnight. It builds quietly over years through accumulated stagnation of qi and blood. The chest tightness, the palpitations, the shortness of breath, that sudden stabbing pain, those aren't random. They're your body telling you the traffic jam has been going on for a long time. In China alone, over 500,000 people die suddenly from heart disease every year. And for anyone with high blood pressure, high cholesterol, or coronary artery disease, the risk spikes even higher in the colder months when blood literally thickens and flows less freely. Exactly what TCM has said for centuries. Blood coagulates in cold. But here's what most people don't know. Before your heart reaches a crisis point, your face will try to warn you first. I'm Jimmy. Today I'm sharing 4 facial warning signs that your heart is under stress, and a simple 3-step protocol to start protecting it today. 4 facial signs your heart is sending a warning. Sign 1, a thickening neck. In TCM clinical practice, people with thicker necks tend to have higher blood pressure, blood lipids, and blood sugar, all closely linked to cardiovascular disease. The general guideline: if a man's neck circumference exceeds 39 centimeters or a woman's exceeds 35 centimeters, that's considered a risk marker. If your neck circumference is above these numbers, start doing gentle neck mobility exercises. Slow forward, backward, and side-to-side movements. Reducing neck tension and fat accumulation in that area matters more than most people realize. Sign 2, persistent facial puffiness. Mild facial swelling after a salty dinner or a night of poor sleep is normal and usually resolves quickly. What's not normal? Facial swelling that stays, where pressing with your finger leaves an indentation and the skin doesn't spring back. That kind of pitting edema can indicate the heart isn't pumping efficiently. If you notice this, see a doctor. Sign 3, yellow deposits around the eyelids. Small, yellowish, soybean-sized bumps appearing around the eyes, particularly in middle-aged and older adults, are called xanthelasma. They're deposits of cholesterol. Their presence is considered a significant risk factor for heart disease. Don't dismiss them as cosmetic. Sign 4, a diagonal crease on your earlobe. This one surprises people every time. Healthy earlobes are smooth. But if you notice a clear diagonal groove running across your earlobe, not a wrinkle from sleeping, but a distinct crease, that can be a sign of insufficient blood supply to the heart. Research has found this crease appears significantly more often in patients with coronary artery disease. It even has a name, the Frank's sign, or in TCM contexts, the coronary groove. Why does it happen? Think of a river. When water flows freely, the riverbed stays smooth. When flow decreases and sediment builds up, the riverbed becomes uneven. When heart circulation weakens, the tiny blood vessels in the earlobe don't get enough nourishment and the skin begins to crease. Having an earlobe crease doesn't guarantee heart disease. But if you also have high blood pressure, high cholesterol, or diabetes, take it seriously. Now, what to do about it? If any of those signs resonated with you, don't panic. TCM has a practical 3-step protocol for heart protection that anyone can start today. I call it the Golden Heart Formula: knead, press, scrape. Step 1. Knead Danzhong, CV17. If you've ever watched a doctor perform CPR, you know exactly where their hands go, right in the center of the chest. That location is Danzhong, CV17. In classical TCM texts, Danzhong is described as the minister protecting the emperor, the heart. It absorbs the attack, so the heart doesn't have to. It buffers the heart from pathological invasion and regulates qi flow in and out of the chest. Here's a simple self-check. Press Danzhong with your thumb. If it's tender or painful, That's a signal worth paying attention to. To find it, it's on the midline of your chest, exactly at the midpoint between your two nipples. How to use it: sit upright, press with your thumb, and use slow clockwise circular pressure, about 50 rotations per session, done deliberately, not fast. The more sensitive it feels, the more your heart needs this attention. Done consistently, this strengthens heart vitality and helps repair cumulative stress. Step 2. Press Neiguan plus Hegu emergency combination. Before we go further, do you know what constitution you are? This matters because the way heart qi deficiency shows up is different depending on your body type. Someone with a qi deficiency constitution experiences palpitations because the heart simply doesn't have the energy to pump steadily. Someone with a yin deficiency constitution experiences palpitations because deficiency fire is agitating the heart. Same symptom, completely different root cause, completely different food therapy and tea pairings. If you press these points but pair them with the wrong diet for your constitution, you'll get a fraction of the benefit. I built a free 2-minute AI assessment at identifytcm.com. It identifies your TCM body type and gives you a personalized daily plan based on your constitution, your location, and today's solar term. Link is in the description. Now, back to the points. Neiguan PC6, inside of the wrist, 2 thumb widths above the wrist crease between the 2 tendons. It belongs to the pericardium meridian, one of the 8 confluent points. It regulates heart rhythm, moves stagnant, qi, relieves chest pain, and promotes smooth blood flow. Widely used in modern TCM for cardiovascular conditions. Hegu Li 4, the webbing between your thumb and index finger on the back of the hand, known as the universal emergency acupoint. Combined with Neiguan, it produces significant effects on cardiac emergencies for both the limbs and internal organs. Memorize where these 2 points are. In a cardiac emergency, always call for help first. But while you wait, these points can buy critical time. Step 3. Scrape the pericardium meridian. The pericardium is the heart's protective layer, its bodyguard. Scraping along this meridian expels stagnant blood, promotes circulation, relieves fatigue, and strengthens immune function. The route runs from Laogong PC8 in the center of your palm, past Daling PC7 at the wrist crease, up to Kuze PC3 at the inner elbow. How to do it: apply gua sha oil or a rich moisturizer to your arm to protect the skin. Gently scrape Laogong in the center of the palm, move to Daling at the wrist. From the wrist, scrape upward toward the elbow in one direction, always upward, following the direction of blood flow, never back and forth. Focus extra attention on Kuze at the inner elbow. Important notes: 3 to 5 minutes per area. Don't force it on your first session. Your body needs to adjust. If redness or scar marks appear easily, that indicates significant stagnation. If nothing appears, that's fine too. It varies by person and session. After scraping, avoid cold water on the area and drink a warm glass of water. The part nobody talks about, one final thing, and it's as important as all the physical techniques combined. TCM says the heart governs the Shen, the spirit and mind, and the classical texts warn excessive joy injures the heart. That doesn't mean suppress your emotions, it means extreme swings. Intense excitement that crashes into exhaustion or grief that leaves you nauseous. These put enormous strain on the heart. If you feel wiped out after laughing hard for a long time or physically sick after crying, that's your heart asking for rest. Nourishing the heart isn't only physical. Emotional steadiness is medicine. Today's summary: 1. Heart disease doesn't arrive suddenly. It builds through years of blocked qi and blood. Check your face for the 4 warning signs: thick neck, persistent puffiness, yellow eyelid deposits, diagonal earlobe crease. 2. The golden heart formula: Kni Danjong 50 times daily. Memorize Neiguan and Hegu for emergencies. 3. Scrape the pericardium meridian regularly and pair everything with your specific constitution. Not sure what your constitution is? Free 2-minute assessment at identifytcm.com, link in the description. After you get your result, come back and tell me in the comments. I'll tell you exactly how to adapt today's techniques for your body type. Thing for today. If this was useful, please like and share, especially with anyone you know who has heart concerns. I'll see you in the next one. Let's keep exploring the beauty of Chinese medicine together.